So let's talk about gynecomastia recurrence. So is there a chance that your male breasts will still enlarge after their gynecomastia procedure? And the short answer is yes, there is a chance, although the chance is relatively small. According to the latest study, the rates of gynecomastia recurrence or gynecomastia coming back after the gynecomastia procedure is approximately 12%. So why this happens? There are two components to majority of the gynecomastia cases. First component is the excessive fat or adipose tissue, and the second component is excessive glandular tissue or actual breast tissue. We get a lot of cases where it's just the gland or just the fat tissue, but frequently it's a combination of the two. The male breast gland can actually enlarge again if it continues to be stimulated with the hormones. Well, we remove vast majority of the gland, more than 90% of the gland during the gynecomastia surgery, so majority of the gland gets removed. However, a small portion of it stays behind, usually attached to the undersurface of your nipple. And although we try to be aggressive in removing majority of it, some of the glandular cells will stay behind, and with the continued stimulation, with the testosterone, with the hormonal abnormalities, with certain medications, those cells can enlarge and they can grow in size, and you can develop enlargement of the male breast gland and develop recurrence of the gynecomastia. However, it's extremely rare. And the reason is, since we remove majority of the gland, those remaining cells, they just don't have enough volume and they never enlarge to the point of the original gynecomastia. Similar situation with a fat component of the gynecomastia. This is called adipomastia, where the enlargement of the breast gland is mostly caused by the excessive adipose tissue, not the actual gland. So what happens if you get the recurrence? Well, bridges are not burned and you can still have another gynecomastia procedure. If this is just a fat component that caused the enlargement of the breast area, the liposuction is an option. Minimally invasive awake liposuction can be performed to address excessive fat accumulation in the chest area. If this is enlargement of the gland, the only good solution is, again, make an incision, usually around the areola, and to get in there and to remove enlarged gland. However, inevitably, there's a little bit of the breast tissue cells left behind, usually attached to the nipple areola complex, and they can get enlarged with the continued stimulation. So it's important to address the underlying hormonal abnormality that caused the breast enlargement to begin with. Sometimes it's certain medications, sometimes it happens during the teenage years when you have a spike in the hormones. So if you have a sudden onset of gynecomastia at a certain age, it's important to check with the endocrinologist to make sure there's no hormonal abnormality or there's no tumor that produces the hormones that stimulate the gland enlargement. For vast majority of the patient, the enlargement is caused by just a hormonal spike during the teenage years. It usually happens on both sides, and as I said, for vast majority of the patients, this is a once-in-a-lifetime procedure where the gland is removed, and if necessary, the excessive adipose tissue can also be addressed with the liposuction procedure. I hope you found this video helpful. Please click the like button and subscribe below. Thank you.